Dr. Karjalainen has been involved in many trials with all of this or main of those studies is related with the use of a new stent, bioinert stent, that is very competitive in comparison with the drug-eluting stent. He has been involved in the TIDES-ACS trial, in the BAS acute coronary syndrome, or even in trial that use the OCT in order to check how is the endothelialization of the new generation stents.
Now we have conducted TIDES-ACS trial. This is, in my mind, very important trial. Earlier we have done, as you mentioned, the TIDES-ACS trial comparing Titan against Taxus. We showed that Titan is superior in long-term follow-up. Then we compared Titan against Science V in BAS ACS trial, and Titan was as good as Science V at 1 year follow-up. And now there is a new stent platform, and that's why we wanted to do a new study called TIDES-ACS. We randomized 1,500 patients 2-to-1, Titan OPTiMAX versus synergy stent.
The Titan stent has been evolved and has been modified, and the new platform is quite well that the platform that was delivered before. Do you think that this new platform may promote better result in the setting of the acute coronary syndrome patients?
Now the device is a coupled chromium platform, so the strut thickness is thinner, and of course we all know that probably if you have thinner struts, the results are better. And certainly I believe that these improvements also improve the clinical outcome, short and long-term follow-up.
You think this new platform for the Titan is very competitive in comparison with the new generation or the last generation stent, drug-eluting stent?
Of course, if you look at the TIDES-ACS results, it looks very promising. So at 1 year, the results are comparable against probably the best drug-eluting device in the market nowadays, and I really hope to see long-term follow-up. So this is really interesting. Actually, this study was presented in ESC meeting in Barcelona this year. This was a late-breaking trial in the ESC meeting, so this was a very big presentation for us. In this presentation, of course, the 1 year non-inferiority was met. What was surprising was that the outcome event in both arms were quite low, around 7%. So now the treatment for ACS has been improved. I mean the medical treatment and also the device treatment. What was also interesting was that the hard endpoints, hard clinical endpoints, cardiac death and MI, they were actually significantly lower in the Titan OPTiMAX arm compared to Synergy.
How beneficial should be in the daily practice with the patient that nowadays treat day a day?
Yes, we have some evidence that Titan is very good also in non-ST elevation MI. So basically nowadays in our cath lab, for instance, we have 50 to 60% of patients with ACS, and we are using quite often Titan OPTiMAX in these situations.
And do you think that the value of the registry should be more emphasized in comparison with the randomized trial?
Registries are very good, but if you want to make some conclusions out from the registries, we need a lot of patients, a very big number. For me and for us, for instance, in our center, when we follow all of our patients in our registry, we really know what happens our patients. So in this sense, the registries are very important.